first of all, to turn the system on and off, the on-off button is right here on the back. Just one simple tap, it'll turn it on, same thing to turn it off. The system, the console will go up and down by pushing on the green handles, pull them up, push down, pull up, whatever height you wish. It will rotate and it will lock. Now, when you come in, if it's the nursing staff that comes in to get the system ready before the doctor enters the room, the first thing you want to do is enter the patient name. You can do this a couple different ways. Probably the easiest way to do it is just to hit the patient ID button here. Okay, it'll drop it down, or let me show you a different way. I'm going to just cancel this out. There's actually 3 different ways. It's a touch screen also. You can touch this to enter patient, and then the third way, cancel it out again, is by activating the cursor, which is right here with the trackball coming up. It's going to put a rectangle around the enter patient, hit the set or select buttons. These buttons do the exact same thing. So, to get to the patient ID screen, this is what it's going to look like. These are the patients that you've done already. This is the new patient that you're going to put in, any new patient information. We do need a patient ID to be able to store images on the system.
Just the last name is all you really need?
ID number.
ID number.
In the patient ID. So let's just put in an ID number. The top part of the screen is just like a keyboard. It's where your patient information is going to go. I'm just going to hit the tab button, and then I'm going to go to last name. And we'll just say test. I'm going to hit tab again, and we'll just put Deb. There's also a box for performing physician. You can put in the doctor's name and the birth date of the patient if you wish. You're going to bring the cursor down, or you can actually use it as a touch screen, whichever way you prefer, and hit start exam, either with the cursor or with your finger. It is all set. Patient name and ID is in there. So when the system is all set, the probes are sterilized. What will happen is the scrub nurse will hand you the sterilized probe. You're going to take the end of that, okay, and we're going to put it into the side, into the port. This, when it's at 2 to 3 o'clock, I say it's in the unlocked position. When you turn it to 6 o'clock, that's going to be the locked position. All right, so go back to unlock. The easiest way to put these in is just to kind of hold one side of the system, slide it in, and lock it. Now, usually we're only using one probe when we're doing surgery. Usually the surgeon, knows what he wants. But let's, for demonstration's sake, let's plug in the other probe, another surgical probe. Same way, there's a port over on this side. So we have 2 ports, one here, one here. Same way, I'm going to put it and lock it. The right port is your default port. So when you have 2 probes plugged in, it's going to default to the one on the right side. Now, the numbers, our probes are numbered, 8816 and 8815. So the one that we have plugged in, this is the 8816, and it's right up there. Now, if I wanted to use the other probe, this is also called the T probe, if I wanted to use the I probe, this one right here, I could go up here, hit on the numbers. It's going to show me a picture of the probe, and it's also going to show me the number of the probe. So I want to switch over to the 8815. I'm going to hit that, and then hit the picture of the 8815. It's defaulted to surgery res, which means resolution. So we have put some presets in. If you wanted to change the preset, if the doctor was requesting a special preset, you're going to just move the trackball or your finger, whichever way as you prefer. And we've got, under the Surgery Pro package, we've got the diagnostic setups. So we have RES, means resolution. I've added biliary, spleen, liver, pen is for penetration, and pancreas. So say we were going to do liver. We're just going to bring the trackball down and hit on liver. I was too small. There we go. and just hit the set or select button. So the probe is all set to go to do a liver exam, and that's actually the 8815. This probe is all set to do a liver. Okay. Now let's just go over the system a little bit. I'm going to lower this down here. When you look at the console, the control board here, I always split it into 3 sections. To the right of the trackball is your black and white imaging. To the left of the trackball is your Doppler, your color, your power, your spectral analysis. And everything on top of the trackball is your patient information and patient workflow. We've already put the patient information in. We want to make sure that these buttons here are in the middle where the dots are. If you look, you can see dots that are in the middle. This is your TGC, or your time gain compensation. It's the fine tuning of your brightness. So it's a plug and play system. These settings that are in here should be all set, but the doctor may want you to adjust things as you go along. So I'm just going to demonstrate here so we can see. I'm going to put some gel on. You wouldn't be using gel during the surgery case. But if we wanted to make this image a little brighter, we're going to turn the B. For brightness, we're going to turn the outer rim clockwise to make it brighter. And you'll see it getting brighter on the screen. To make it less bright, we're going to go counterclockwise. Okay. If the doctor wanted a different depth, it's defaulted to 7.3 cm. Say we're doing a liver, the liver is it's enlarged, he wants to go a little bit deeper. This button here that has the magnifier and the arrow on it, you're going to turn the outer rim clockwise to go deeper in the body, and you'll see the depth changing. 9.8, 11.3. Counterclockwise will decrease the depth, so you'll be more shallow. All right. Now, if you're on an area and the doctor wants to magnify it or zoom it, push the magnifying glass in. You're going to get a square box. What you can do is move this box around to the area that you want. Blue is an activation mode, so we say we want it right on the middle there, but we don't want the box that big. Plus or minus is going to make it bigger or smaller. We're going to hit the minus sign to make it a little bit smaller. When it gets to its maximum or minimum size, it's going to beep at you. So it beeped. This is the smallest I can go, but I'm just going to move the box up, right there. Now I want to magnify that area right there. So I'm going to push the magnifier again, and we're in a magnification mode. To get out of the magnification mode, just push the magnifier again, takes you right back to your original depth. Let's say we had the brightness turned up, we had changed the depth, and the doctor is saying, oh, I don't like this image, let's go back to what we started with. To get easily back to your setup, to your preset, hit the reset button, or the little house, go to a safe place, go home, hit that reset button, and it's going to take you right back to your original preset. If the doctor wants you to freeze that image, because he's saying there's a mass in the liver that he wants to measure, we're going to push the big old snowflake there. We're going to freeze it. Stops the motion. And I says, you know, I just want to measure that mass there. I'm going to hit this button here. It has the X's with the 3 little dots in between. That's a measurement button. What I'm going to do is move it around. I'm going to put the cursor on, say, the edge of a periphery. I'm going to set it. I'm going to move the cursor again to set the other side. Now he wants an AP measurement. Hit measure again. The cursor is hidden behind the last one. I'm going to move it up. I'm going to set it. The other cursor, I'm going to set it to the posterior side. Now notice, you also have color-coded boxes. So you want the cursor to go on the periphery, not the box. The color-coded box is going to tell you what distance you're measuring. We can do multiple measurements. Just keep hitting that measure and set and select button. As I said, these two do the same thing. Say you want to get rid of one of these measurements, you decide, oh, I don't want that last measurement. We can get rid of it by just bringing down the cursor hitting set and select and just hold it, it's gonna get rid of that measurement. Say the doctor says, well, you know what, that cursor, it's not right, I need you to move that up. Instead of erasing and doing the whole thing again, just move your trackball, bring your arrow up here, it's gonna turn it yellow. Remember, blue is activation mode, so I'm just gonna set it, turn it to blue, and then I can remove that cursor, say right up to the skin line or to the most anterior part and set it. When you unfreeze, the cursors go away and the measurements go away. Okay, so we're scanning along. He's got the image that he wants. We're going to freeze. Now he wants you to print it out on a black and white printer. If you hit print, it's going to print it out and it's going to automatically save it into the hard drive. So you only have to hit the button once. If you want to just save it, we're going to hit the freeze and the save button. And that's going to just hit it up to the hard drive. I'm just going to reset this, Donna. I think because it was unplugged here. There, that was just the printer. Okay, all right, so we're scanning again. So those are the buttons over here. The only other button that you may want to use
Zoom in on the buttons.
is the focus button. The focus button is what I call the big parenthesis, which correlates with this over here. That is where your area of detail is. Say you're looking at something in the liver and it's a mass, but it's a little bit deeper. I want to move my focus where it's going to be the most detail. I want to move it down. I'm going to press that focus. I'm going to use the cursor and bring it down. I can also adjust the size of the focal zone by hitting the plus. I can have it really big, or I can hit the minus to make it small. And then I'm going to just hit it so it sets it again. So we're looking at something, and let me get to a vessel here. Now I'm going to demonstrate your Doppler. So I'm going to go, actually it's just easier if I do it on my neck. Okay, alright, so I'm going to take a look at my carotid here. Just going to adjust the depth just for, okay. So, say we were looking at a vessel. The doctor wants to see if something is vascular. A couple different things you can do. If you push C for color, it's going to activate the color mode. And you're going to see vascularity within my carotid and my jugular. This is all artifact for me talking, so I'm going to stop talking. Now, if you get any of this artifact, to adjust that, you're going to turn that outer rim. That's going to decrease or increase your color. It's your color gain. To get out of that, you can either push color to get out of it. Okay. Now say I wanted to just see if something was vascular. I didn't care. Color is for direction of flow. If I just wanted to see if something was vascular, I can hit the power Doppler, which is just going to tell me, yes, it is vascular. So if I hit P, it's a different color map. It's an orange. I'm just going to freeze this because I want to demonstrate something. So I'm looking at something, say we're looking at some vessels in the liver. Okay, I know that these are vascular. It looks like a vessel, but there's no color in it. That's because it's a cyst. It's a cyst actually on my thyroid. But the power is going to show that. So if there's a liver cyst, it would also show there's no vascularity. So it tells you, yes, it is a vessel, or no, it's not a vessel. Now, the other way to get out of this power, you can either hit P for power, or you can just hit the B. You have to unfreeze, sorry. Hit B to go to black and white imaging. Okay. Say we were in color, and I'm going to go look at my carotid here. And I'm not sure if they will be doing any Doppler analysis. If you want to get a Doppler or a spectral analysis, I'm going to hit the D for Doppler. I'm going to move and put this D. I'm going to hit that auto button. Now, when I hit the auto button, what that did is that automatically adjusted the scale and the baseline. So it's one extra step you don't have to do. The doctors may want to do it just to see if something is arterial or venous. To get out of it, we're going to unfreeze and just hit B to go back to black and white scanning. So we've gone over the main buttons. They're also labeled, the ones that you're going to be using. And that's pretty much it.
Okay, so just gonna turn on the button.